can you please just maybe introduce yourselves to our audience a little bit and let us know how you became involved in healthcare issues?
Hey, I'm Barbara Harrison, and I began working on single payer when I lived outside of Washington in Virginia, and I began in 2009 on Medicare's 44th birthday. And part of the reason I got involved was my own lack of health care. And I have one of my master's degrees is in community change and civic leadership, focused on environmental justice. And I finished that degree at the time the economy was crashing, and I felt I needed to become involved with something, an issue that would relate to my degree to try and begin to make change.
And what about you, Rebecca?
Well, as a teacher for many years, I worked with families who didn't have health insurance or adequate health care, and could see what an impact that had on children. Their teeth were often in very just much a problem for them, and it impacted on their learning. And so when I retired, I started going to meetings and learning about the issue, and the more I learned, the more I became involved in it. And from a personal point of view, I grew up in Canada, and my mother lived in Canada until she died in the 90s. And although my brother and I both live in New York State, she always said that she couldn't leave Canada because of her health care. And that was very significant to her and to us as well.
So the both of you help out with a organization called Single Payer New York. So maybe we can just define the term really quickly. What actually is single payer? What does it mean to our listeners who might not be familiar with the term? They might have heard it, but they might not know what exactly it means. So maybe you can lay that out for us.
Sure. Single payer refers to a method of financing our healthcare system. One entity, and often it would be the government, would handle all billing and payment for healthcare instead of hundreds of private insurance insurers. And it's somewhat similar to Medicare, but we know that Medicare doesn't cover everything and does require premiums. So a single payer system would be an improved and expanded Medicare to cover everyone with very comprehensive care with no out-of-pocket expenses or premiums.
And I'm curious about what's been going on here locally in Ithaca and also in the state of New York with regard to advocating for a system like that.
Well, locally we have what we call a chapter of Single Payer New York, which we call the Finger Lakes for New York Health. And the New York Health refers to the bill in the State Assembly and the State Senate that would give New York State single payer health care. So we've been working on two levels, the federal, which is John Conyers' bill, H.R. 676, and the state level, which is Richard Gottfried's bill, and the sponsor in the Senate is Bill Perkins, and that's New York Health, and that's the Assembly number is 5389, and the Senate number is 2078. So that's one thing we're doing, and we've been trying to get the word out through tabling at various local events, whether it's the Ithaca Festival, Juneteenth, some of the Hispanic festivals that we have. We have shown a movie at the Unitarian Church. We do tabling with petitions that at that point we give information about that's education, the bill, and single payer in general, as well as ask people to sign a petition to Governor Cuomo for his signature on the bill when it comes to his desk. I have put together what I call visual storytelling, so it's a video about people's stories of their experiences with the healthcare system, and that's called Speaking Out for Healthcare for Everyone, and that will be coming out shortly. Rebecca, go ahead.
And most recently, we were petitioning at the Robert Reich movie, Inequality for All, because we know that if you don't have health care, you are in deep trouble in terms of having equality and access to care. And Robert Reich has an article that he's written called Medicare Isn't the Problem, It's the Solution, and has spoken out quite strongly on this topic. So we try to take any opportunity we can to reach out and educate people, talk to people in the streets, and to talk to everyone whose ear we can get. And we've had a number of movies that we have showed locally at senior centers and at various public gatherings, and we would like to continue that. We have a movie called The Healthcare Movie, which is a comparison of the Canadian and American system and shows pretty vividly how they evolved into their system. We both started at the same place virtually 50 years ago, and when we took two different paths toward healthcare, and we see now where they have a national basically single-payer system that covers all Canadians, and we have a very fragmented, multi-tiered system, which leaves at least 45 million uninsured.
So let's talk about a little bit more about that, the current state of healthcare in the United States. There's been a lot of talk in the media about the Affordable Care Act, and not a lot of talk in the media about a single-payer system. And so currently, the what the media is talking all about right now are the computer problems with the Affordable Care Act. But that's not actually that's an IT problem. That's not a healthcare problem. And so I think the real story about the Affordable Care Act is something very different. So maybe you can tell us a little bit about your thoughts on that.
Right. We worked very hard during 2010 and when this was all evolving to try to influence the decisions on where the legislation would go. And as many of you know, single payer really was off the table and not considered. And that was a big disappointment because as long as the system is based on a private for-profit system, it will continue to be very costly and it will continue not to cover everyone. And that, in fact, is what's happening with the Affordable Care Act. We find that people are trying, there are the computer glitches and they will work that out. We are confident about that. But it is a very complex bill, and it evolved from a very conservative think tank. The Heritage Foundation was initially where the plan came from for the Massachusetts plan. And the Affordable Care Act is based basically on the Massachusetts plan.
Right. So I think, well, I hope a lot of people do know this, that the kind of the idea of the Affordable Care Act, a lot of people know it from a different person who didn't end up being our president. It was kind of a Mitt Romney bill before it was an Obama bill.
Right.
And so I'm curious why our Democratic president seemed to be doing something we would have expected Mitt Romney to do.
Well, it depends. It depends on where you take your money from, and the healthcare lobby is quite, and most corporations have huge lobbies, huge numbers of people that lobby in Washington. If you look at when the bill was written by the chair, one of the main contributors to the bill was Senator Max Baucus, Democrat from Montana. The person that helped him write the bill was Liz Fowler, who was one of his ex-staffers, who at that time was part of WellPoint, which is an health insurance company. President Obama then took her on for a commission, and now she's gone to work at Johnson & Johnson. So money and power are the main staples in our political world, and especially in Washington. So that puts a lot of fear into people in terms of how they function, and depending on where they want to go in the power structure, they will bend and flex to the music of the lobbyists, to money. And just to add to what Rebecca was saying about care in Massachusetts, access to care has barely budged medical bankruptcy. It's not uncommon to find people going bankrupt, and costs also continue to grow for people to pay for a mandated law, so for care. So.
And maybe we can talk a little bit more about what a single-payer system in the United States would look like. And I'm wondering if it can work economically, and also if it can work politically in this political system that we've already discussed to be dominated by big money and corporate interests.
Okay, what I'll do is I'll compare a single-payer bill, H.R. 676, John Conyers bill, and what's going to be transpiring with the Affordable Care Act. So in a single-payer system, under universal care, we use the expression everybody in, nobody out. So everybody would be covered automatically at birth, from cradle to grave. There are no questions, they would be covered. In the Affordable Care Act, close to 30 million people will remain uninsured, and tens of million people will remain underinsured. In terms of a range of benefits, coverage for all medically necessary services people would be covered for that, and insurers, in terms of the Affordable Care Act, the insurance companies, which would still play the major role in the ACA, or Obamacare as it's also known, will continue to strip down policies and increase co-payments and deductibles, and also find ways of pushing people out of healthcare so that they continue to make a profit. That's what the main focus of the insurance companies is to make profit for their stockholders. They're not there really to provide care.
And in fact, that is their job, is to make money for their stockholders. So they are performing the task they've been assigned very well.
Right. And ACA remains a market-based format of providing health coverage to people. It's not about care, it's about making profit. So if we went to a single-payer system, over $400 billion on the federal level of administrative waste would end up going to increase health spending. And millions of dollars on the state level in New York State, if we went to a single-payer system in New York before H.R. 676 would take effect, would be saved that could go to human services and back into taking care of people. So the ACA would increase health spending by $1.1 trillion over 10 years, adding further layers of administrative bloat to the health system through the introduction of state-based exchanges. So the public is subsidizing private industry so that they can continue to make profit off of people's illnesses and their backs.
And so this kind of is sounds to be a little bit like a corporate welfare scheme, but it doesn't really do anything for the welfare of the majority of the population. I guess I'm wondering about the prospects for getting the ball rolling on healthcare reform here in the state of New York. Maybe we can go back to that subject, and also thinking about the idea of waste. And what's really going to be more wasteful? I think there's a lot of talk in the media about how government can't do anything right and government's wasteful and all those kind of things. But I mean, don't you see the exorbitant profits that are being brought in by the large interests that dominate healthcare in the United States? don't you kind of consider that profit to be a form of waste?
Oh, definitely. And millions, CEOs of the insurance companies are making millions of dollars every year. And in fact, they continue to just build. And so, in fact, this Affordable Care Act has helped the insurance companies by adding to them. One of the key things that's important about not-for-profit system is that all the money would go, most of the money would go to care rather than to profits. And at the state level, you were asking what we've done. Last year, we had a large petition drive. We're working with groups in New York City and locally in Albany and Buffalo and Rochester. And we then culminated it in a large lobby day in May where we had 200 people going to lobby, about 90 of which were either doctors or pre-med students or med students who were going with us to lobby our legislators. And as a result of that, we added a number of new sponsors to particularly the Senate bill. We actually would have enough sponsors to pass the Assembly bill, the bill in the Assembly. But Sheldon Silver has not seen fit to bring it to the floor. And that's one thing we've been pushing for because we knew it would pass if it came to the floor. We do not have enough supporters in the Senate yet, so that's going to be the thrust of some of our work this year, is to try to convince more senators. We have 19, and we would need 33. But one senator I heard yesterday, after seeing us in Albany in May, said that he was much more interested in this and wanted to find out more and would probably sign on. So we're going to be working on current senators and also people who are running for the Senate and trying to find candidates who would be supportive of single payer at the state level, knowing that that would be step one, and then we would move hopefully from there into a national system.
And one of the last things I'd like to bring up is the need for preventative care, and kind of this healthcare safety net, and basically the social costs of not having one. We just had a story in the news today about the relationship between poverty and negative health consequences later in life,
Right.
and I see this kind of as a vicious cycle where poverty and health problems are both kind of reinforcing each other and perpetuating a system that's just not really good for our economy or the productivity of Americans. And so I'd like to know your thoughts on those issues.
Well, with a single payer system, the way it would be paid for, people would pay according to what they earn, so that it's not a flat premium like the ACA. So people would have a card, they would not get billed in the mail, they could go to the doctor when they need to. Right now, people end up going to the emergency room when it becomes an emergency, and they don't have continuity of care. So single payer would offer continuity of care as well as where people would hopefully not wait until it becomes critical, costing them as a person, possibly shortening their lives, and costing the system more money. The other thing is that even with the ACA, if you don't fall into the lower income for Medicaid, where you'd be able to obtain Medicaid, you're going to be rather squeezed for coverage. Single payer, everybody's in, nobody's out. You would just go and get what you needed when you needed it. And there wouldn't be bankruptcies, medical bankruptcies, where people would accumulate so much debt because they've waited too long to go, and then they need to go because it's become an emergency. No other country is in the position, no other industrialized country is in this position.
And we just have one more minute, and so I just wanted to quickly finish up with, I'm wondering about just your prospects for plans for the future of the single-payer movement here in New York and nationally. I think I heard that you guys came back from a conference in Tennessee recently, and so I'm just wondering about that really quickly.
Well, I feel very encouraged that more and more people are hearing about this, and I actually have to commend WRFI because in the last 2 or 3 weeks, there have been many people on various programs like Letters in Politics and Democracy Now! Talking about this very issue and actually talking about single payer and we should be going in that direction. So I think I am encouraged that we really are starting to get the message out, and we just have to continue to do so.
How can people find out more information about Single Payer New York?
Okay, we have a website which is at Single Payer NYS. Oh, I'm sorry. It's Single Payer New York, and that's completely spelled out, .org, or you can email to singlepayer, N as in Nancy, Y as in yacht, S as in Sam, at gmail.com.
Barbara Harrison and Rebecca Elgie from Single Payer New York, thank you so much for being with us on WRFI Community Radio News.
You're welcome. Thanks for having us.
Thank you.
That about does it today for WRFI Community Radio News. Thanks so much for joining us. Feature Story News is next.
I'm Kevin McAleese. Today, Germany's fury over allegations that the personal cell phone of Chancellor Angela Merkel was monitored by US intelligence.
We have always expected that the Chinese and the Russians would tape our phones, but that an ally and friend is doing this is shocking.
America's espionage activities overshadow a summit of